Okay, so my sharing to this afternoon will be from the perspective of a caregiver, all right, a caregiver for caregivers. I think this is a very important area which we haven't really touched on a lot, but there was some sharing yesterday, and I'm glad there was actually a sharing on caregiving. I still want to talk about the topic of stigma. All right, we have talked a lot of stigma the past 2 days. Even this morning, there were some questions and some answers about it. I just want to mention one point. Right, in Singapore, a lot of studies have been done on stigma, and generally it's acknowledged that stigma is still very high in Singapore. Even though we have done a lot of work in the area, yes, improved, but stigma is still high. But another interesting point is, if you have information, if the person has more information about mental illness, their acceptance level tend to increase. They are more gracious, they are more accepting, they are more understanding, and that means they are less stigmatized. And what does that mean? Right? It means that we need to really raise the awareness of mental health, mental illness to the public, to everyone here, so that when you have more information and you understand it better, you will have less stigma towards that topic. Okay? And applying that stigma issue upon myself, when if within my family, right, we are a very stigmatized family towards mental illness, right, the way we grew up in our society and so on. And over 20 years ago, when my sister was diagnosed, with with major depression and anxiety disorder, I think that came as a shock to the family, and basically we didn't accept it. Say, how can it be? Right? What is depression? All right? We didn't know anything about mental illness. We didn't know anything about depression, but we just know that it's not a good thing, right? In fact, my father, my late father actually, he said it brought shame to the family. So you can imagine, the lack of knowledge, the lack of information, the stigma that surrounds mental illness actually brings a lot of negative connotation, even within the family. And even for my sister herself, self-stigmatized, right? So this whole issue of stigma in the family resulted in her not receiving early treatment, all right? And you know that if it's no early treatment, if it gets dragged longer and longer, the issue the illness will get worse, and it'll be even more difficult for the recovery journey, okay? And so there were a long period of time when she encountered lots of issues at home. She was very frustrated. She was crying. She was isolated. She was not seeking treatment. But yet the rest of the family, even myself included, we didn't really quite do anything. All I did to tell her was, what's there to be depressed about? Right? Everyone has problems. Just snap out of it. I think you probably hear this quite a lot. These are some unkind words which sometimes as family members we use that on our family members, and that's really a wrong thing to do. And she went through many tough times, many relapses, and one day she had to be warded at the Institute of Mental Health. Okay, and then I think that dawned upon me that perhaps I really need to do something more for her. But I wasn't really still actively pursuing or trying to find out more knowledge and so on. Right? But another major relapse came, and then she became suicidal, and this time around, it's getting worse. And so we really was panicking at home. We're not sure what to do. And during that time, I was having lots of issues with my own work. All right, very tough work, long hours, and my mom was experiencing heart problems. So everything came together. I'm the sole caregiver for the family, and so it was very tough for me. And I had to quit my job at one point in order to remain sane, and also to be able to better care for them, right? But all is not lost, because in between all this, right, that's when one of those days when I brought my sister to see her psychiatrist, who happens to be Dr. Joe, and he told me, go to Caregivers Alliance, because they have just set up a caregiver support center at the IMH itself, and he said they can help you, they can support you. So I'm very thankful I did. So thanks Dr. Joe for really introducing Caregivers Alliance to me. All right, the organization that I work for now. So I went to talk to the staff, and subsequently I also met up with the founding executive director, who's Dr. Sally Teo over there. So, this sector is really quite small, but I'm thankful that we are really all, doing this work together, right? So I met up with her, and then she encouraged me to join in the signature program at that time, the Caregivers to Caregivers training program. So this is a 12-week training program, and it actually allows me to know more about mental illness, gain a lot of knowledge on that, learn about crisis at home, how to handle, or problem solving, how to empathize with my sister, what she's going through, how to communicate better with her, and also how to exercise self-care for myself. And I learned about recovery, and I learned, that I need to advocate. I need to share my story. I need to share, I need to advocate against stigma, raise awareness, and so on. So I've been doing that for many years now, and I think the course really benefited me a lot. I was able to change my mindset towards caregiving and mental illness. I became a volunteer, and now I'm becoming a staff, and I'm very glad that I can share with you here today. So I hope the issue of stigma has been driven a lot the past 2 days. I hope all of you will leave this place really more informed and not be too stigmatized about this issue. Okay, can I have my slides, please? So now I'm going into just sharing a little bit more about Caregivers Alliance. I won't talk about vision, mission, and so on, right? I mean, we are 12 years charity, we're a small charity. I just want to quickly focus on the needs of caregivers, okay? So, is it okay? Yep. Oh, overshot. Okay. So we have been dealing with caregivers for the past 10 years or so, and then I think we really quite know what they really need, right? The first and foremost, they really want to be better at caregiving, right? That's the natural thing they want. So they need knowledge, right? They need to change their mindset. They need to learn some skills and so on. And this is what we are trying to help them with. They need a support network, right? They need a lot of emotional support, and definitely they need a lot of friends so they can share and they can learn from other people as well, other caregivers, other professionals. They need to practice self-care. They need self-care, and they need time for respite, right? To be able to find time, to engage themselves out of caregiving, right? Because there's so much stress and burden in caregiving, and of course they hope to be able to find purpose and meaning, right? Caregiving is a long journey, right? If you don't find purpose and meaning in caregiving, it's going to be a very tough journey. Okay, so what has Cal been doing for them, right? So the 12-week program that I mentioned, so that's the signature program. We've been running that for 10 years, and we've trained over 6,000 caregivers by now, or probably even more. Since then, we also extended the program, other than just for persons with mental health issues. We've also extended that to dementia, caregivers of persons with dementia, caregivers, young caregivers as well. I think recently there have been a lot of rise of mental health issues in youth. So we also having a course on that, a training on that, and we also now have a training program for caregivers of persons with eating disorder as well. I mean, there's a few other things that we do, but generally these are the main programs that we are running. And once they have completed this C2C training, all right, we also going to continue journeying with them. We encourage them to join a support group. We call it Caregivers for Caregivers Support Group. This is a one-year program. Right? They will continue to learn more mental health knowledge. They will continue to empower themselves. They will find new friends, and from there widen their support network. Right? Okay, and they continue, right? And just like I mentioned, purpose and meaning. So what we try to do in this area is we encourage them to be volunteers. All right, just like many of us did, we became volunteers, and they can volunteer to be a trainer. So in the C2C training, they can be trained to become a trainer, or they can volunteer to be a support leader, where they can provide emotional support to other caregivers in the class. They can also do sharing. They can also share their stories. They can also do outreach support and help us to do outreach to other caregivers. We also get them to involve in various other activities, right? So this is, in a sense, to empower themselves, to empower other caregivers as well. So they find purpose and meaning in that. Outreach and partnership, we do a lot of talks, mental health talks, to raise awareness, and so we have been doing this not only at the hospitals, but also at faith-based groups, corporations, communities, even the schools as well. So we believe that caregivers can be anywhere, and so we reach out to them in these areas. And we want to continue to journey with caregivers by engaging them with activities. Could be fun activities, or could be learning opportunities, where we bring them together and then they have some respite time as well. So these are some of the things that we've been doing for caregivers. Okay, just a quick slide on what some of the caregivers say. This is what some of the comments that they make after attending the 12-week training program. One very common comment is that they are not alone. And I think just feeling that, just knowing that alone is actually a revelation that you are not alone, that there are many people in the same boat, but there is support for you. All right? Many people during the graduation will share that they have really benefited a lot from this training program, just like I did. Okay. Oops. Okay, so just one slide about outreach and so on. So stigma, right? Because a lot of caregivers don't just come straight to us. They don't just raise their hand, I'm a caregiver, I need help, please help me. No, most of them don't do that. All right, although now we're seeing a little bit more coming forth, but generally we still need to look for them. And caregivers, we call them hidden heroes because they are usually behind the scenes struggling and having all the burdens and so on. So we have to go out and seek to find these hidden heroes, right? So as I mentioned, we do a lot of one-session talks. That means it could be a talk on understanding mental wellness, a talk on self-care, or just about stress, right? Just to raise a bit of awareness, and from there we see whether there are caregivers amongst the audience and see how we can support them. We do exhibitions and events like this, and also we also get referrals and so on. So we try to reach out to as many of these caregivers as possible. And as mentioned also, we do this at all these locations, like hospitals, corporations, communities, and of course churches as well. So we've done a lot of work at the churches. Yesterday, someone came up to our booth, and then I know we're still here. She asked, what is a caregiver, or who is a caregiver? Or what's the definition of a caregiver? So I just said that, if you're caring for someone with all these conditions, it could be mental health, it could be a chronic disease, it could be disability, or dementia, or anything, you are a caregiver. Someone in the family, or even a friend sometimes. So you are a caregiver. And it is important. Why we always ask this question? Because a lot of times when we share sessions like this and we ask who is a caregiver, most people do not identify themselves as a caregiver. Strangely, they will think that, oh, my parents are the caregivers. Oh, my domestic helper is a caregiver. I'm not. I just provide the financial needs. So it's kind of strange. But here we're talking a lot about family caregivers, caring for someone at home. And this is, I think it's important to self-identify as a caregiver because the challenges, the responsibility can be overwhelming, and suddenly you realize that you really have to play that role, right? So it can be challenging. So it's good to know early. Okay, so if your answer is yes, right, you basically understand that it needs time, commitment, sacrifice, and even money. But then definitely we are here to support you. Okay, one more slide about. Okay, wait. Oh, this. No, okay. No, I just want to show a quick slide about all the different churches that we're working with over the past few years. Probably not the full exhaustive list because you already covered the whole screen. But many of the churches, we do a lot of talks with them. We also even run C2C training with them. Right now, if you look at the first one, Adam Road Presbyterian Church, we are actually hoping to start a class in 2 weeks' time, a C2C at their church premises. So we do that, a lot of partnership with these churches, right? And so the last slide here, I just want to say that this is how you can contact us, or you can see us at the booth. I think we really definitely can be a resource to all you pastors out there. Come check with us to see how Caregivers Alliance can support you. Okay, thank you very much.
Thanks, Derek. Thank you for your sharing.